Good afternoon, ladies and gentlemen. I'm Jordi Merchan Bravo. I'm a medicine student of the Católica University of Santiago de Guayaquil, and today I will talk to you about survival and neurodevelopmental outcomes among periviable infants. Definition: the possibilities that a premature infant survives is influenced for the age gestational, the weight to the birth, the presence of serious problems of health on having been born, respiratory, cardiac, infectious malformations, etc. Of all of them, most important is the age gestational, since it determines the maturity of the organs and specifically in neurological development.
By the time a human embryo is 5 weeks old, it is just the size of an apple seed. The brain has already begun to grow. By 8 weeks, the basic structure of the brain and central nervous system is formed, and neural connections are at rest and moving now at rates faster than 150 miles an hour. At birth, nearly all 100 billion neurons of the human brain are already in place, but the brain only weighs about 25% of what the body knows. It's about to embark on its fastest growing period, quadrupling in size by the time a child finishes preschool. By age 6, the brain is 90% of its adult size. During that burst of growth, 700 new neural connections are formed every second. As we gain the capacity to smile, grab toys, to talk, usually around a year, and to dress ourselves around the age of 3. In those early years, in fact throughout our lives, the brain changes through experience. Learning to speak, taking those first steps, understanding colors and shapes, learning novel thoughts. There are certain neurons that use more frequently. Other unused neurons go away. It's a process called pruning. And almost anything can shape us in those baby and toddler years. First words, first ice cream, first TV show, first argument, for better or worse.
Applications in nursing. The professional work with the family together to design a plan of taking care and to structure environments of support individualized to the infants. They realize regularly formal observations of the behaviors of every infant, which take form on weekly reports of the neurological readiness and do recommendations to promote the stability and competitions of autoregulation and communication of the infant.
Making our own movie. Yeah, that's the side I gotta see.
Crying again. I'm done with the TV and air show. There. Nope, but he'll learn. He'll know where the I do now?
That was great.
Thank you.
You're a pro.
Pros and cons. Disadvantage. Present problems with his motive development. Present difficulties to learn, to understand, and to pay attention. Problems of behavior as aggression, anxiety, or problems with the social skills they might happen. Medical disorders like the asthma, convulsions, cerebral paralysis, or autism.
Hey, Princess. You're at 26 weeks gestation today, but your lungs have actually gotten worse. You're the only person involved who may be suffering more than I am. I pray that you never have to feel the way I do now. I love you, Raven Nicole. Mom.
We're often asked, why are preemies sicker? What really happens to them? And there's really a whole host of explanations. Their lungs aren't very mature often, and sometimes even if there are enough little air sacs in their lungs, they don't have all the right chemical properties to help the lung function. The intestines are immature, the brain is still immature, and even the immune system is immature, so it's hard for some babies to fight off an infection.
Now you'll see how the NICU equipment you just learned about helps treat the common medical problems experienced by premature babies. Tests may be performed to see if your baby has any of the following problems. Respiratory distress syndrome, or RDS, is a common breathing problem in preemies. It's caused by lungs that are too immature to function well because they lack surfactant, the substance that helps lungs stay open between breaths. The lung on the left shows you how a mature lung stays almost fully inflated as air moves in and out of the air sacs. The lung on the right shows a preemie with RDS. Notice how the lung is smaller and doesn't inflate fully, and how it collapses between breaths. This collapsing makes it difficult for the air to move in and out easily, so taking each breath is more of a struggle.
Issue applies in Ecuador. Ecuador is the second country with a minor rate of premature births in the world. According to the World Health Organization, here the index of premature births is of 5.1, that is to say 5.1 children for every 100 are born before 9 months of gestation.
Well, I have some concerns about his development. Like, is he going to develop slower than normal kids? Is he going to grow slower? I mean, what kind of things are going to happen to him since he is a preemie?
Most parents of premature babies want to know, will my child develop normally? This is a question without an easy answer. Every baby, no matter when he was born, develops at his own rate and in his own way. That said, preemies are known to be at a higher risk for developmental delays than full-term babies. The best advice for parents of preemies is to pay attention to how your baby develops and to get regular professional assessments of his development as well. Ask the NICU if your baby is eligible for an early intervention program, which might include physical and occupational therapy appointments in your home. You should use your child's corrected age when assessing his development instead of his chronological age. His chronological age is determined by his birth date. His corrected age is determined by using his due date as his birth date, or by taking how old he is and subtracting the number of months or weeks he was early. For example, if a baby was born 2 months early, at 8 months of age, his corrected age is 6 months. So even though he was born 8 months ago, he may act more like a 6-month-old baby. You should continue to use your child's corrected age when assessing his developmental milestones until he's around 2 or 3 years old.
Conclusion. The cycles related to a disorder only neurological, it has consequences on the vision that it had of the infant and his evolutionary possibilities.
Developmental milestones are major achievements that every baby needs to go ahead and pass over the first years of life. Premature babies sometimes meet those milestones a little later than full-term babies. Now, milestones are just guidelines. Every baby needs to see their doctor and be followed to make sure they're hitting those milestones appropriately and continuously. So when we think about developmental milestones, which are major achievements, we think about areas about muscle and motor function, fine motor activity, like being able to pick something up and transferring it, and gross motor activity, things like walking and kicking the ball. We think about cognitive ability, the ability to think and sort out and learn. What color is this one?
It was.
Red. Correct. And we think about vision and hearing. Every doctor follows those milestones over the first years of life. Did you go for follow-up to the pediatrician for Jonathan?
Yes, frequently.
And when did Jonathan begin to do things like, say, mama and dada?
Around maybe 6 or 7 months, little sounds here and there.
And that's pretty good. When we talk about premature babies, we have to consider their birth date and their due date when we think about, are they on track in their developmental milestones? If most babies sit up at 6 or 7 months, premature babies who are born early might sit up a little later than that. So their birth date is not really the time when you start marking their milestones. It's based on when they would have been born rather than when they really were born. And premature babies sometimes have problems with hearing or vision, and that will sometimes cause also some problems with speech. Jonathan now, at 3, does he have any sentences or does he speak a lot?
Yes, he tells a lot, and he'll say, she hit me. He'll say, Mom, I want juice. You know, the enunciation isn't that great, but it's still, you know, I understand everything he's telling me.
Premature babies sometimes will need specialists to optimize their abilities. I want to thank Jonathan and Sharon for helping us to learn more about milestones in premature babies.
Thanks for your attention. I hope these presentations are helpful for you.